Good evening, guys. I have D for you. We're discussing why aging drives in home care demand. The phrase the aging population is driving demand for quality in-home care services reflects profound demographic and societal shift that's reshaping healthcare delivery, labor markets, and family dynamics. Here's a deeper dive into the forces behind it, demographic realities. Global aging trend. Countries across the globe are experiencing a shortage or a surge in the population of older adults. In the US, for example, the number of people age 65 and older is projected to nearly double by 2060. Longevity versus health span. While people are living longer, many are not necessarily living healthier. This mismatch creates a prolonged period of dependency and care needs, shrinking caregiver pools with smaller family sizes and increased geographic mobility, fewer adult children are available to provide informal care, especially in rural or underserved areas. Aging in place, a cultural and clinical uh, imperative. Emotional and psychological benefits. Remaining in familiar environments helps preserve dignity, autonomy, and mental well being, especially for those with cognitive impairments. Cost effectiveness. In home care can be more affordable than institutional care, particularly tailored to particularly when tailored to specific needs. And resource and supported by community-based resources. Cultural cultural preferences. Many communities, especially those with strong intergenerational ties or mistrust of an institutional systems, prefer home-based care that aligns with cultural values and traditions, raising complexity of care needs. Multi-morbidity. Older adults often live with multiple chronic conditions requiring coordinated continuous care. Cognitive declines. Dementia and related conditions demand specialized person-centered approaches that are often best delivered in the home. Post-acute recovery. Hospital discharges increasingly rely on home health services to prevent readmissions and support rehabilitation. Workforce and systematic challenges. Caregiver shortages. The demand for home health aides and personal care assistance far exceeds supply, leading to burnout and turnover. Training gaps. Many caregivers lack adequate training and culturally responsive care, dementia supports, and trauma informed approaches. Policy innovation. Governments are experimenting with subsides, Medicaid waivers, and public private partnerships to expand access and improve standards. Implications for equity and innovation. Marginalized communities, disparities, access to quality in home care persist, especially among rural low income, and racially diverse populations. Tech enabled solutions, remote, remote monitoring, telehealth, and digital caregiver support tools are emerging to fill gaps, but must be adapted for cultural relevance and digital literacy. Participatory design, co created toolkits, life review prompts, and caregiver resources tailored to specific communities like rural African American elders are gaining traction as scalable equity driven innovations. If if the page you're viewing includes specific data, case studies, or policy proposals, I'd love to help you translate those into actionable frameworks, especially if you're thinking about culturally adapted outreach, infrastructure mapping, or caregiver support strategies. Just say the word. Okay, guys, so I will be back on to do another one in a little bit. I'm going to take a little break and I will see everybody for an show tonight. So for now, Gator Wellness, take care, folks.